जी मैडम लाइव हो गया हूँ मैं। हाँ मैं हो गया, वहाँ से आप लोग ऑन करिए। हेलो। वहाँ से आप लोग ऑन करिए। यस, आई थिंक आई एम लाइव नाउ। So am I audible? Can you hear me? Hello. I think I am audible. Can you hear me? Yes, I think I am live now. So am I audible? Can you hear me? Yes, I think I can hear in my mobile. Okay, now I'll start. So a very good evening everyone, and first and at the outset let me congratulate all the FMG aspirants who have toiled hard and studied and gave this exam. So a big congratulations to all of you. And what we'll do, we'll try to take recall based questions of PSM which was asked. Now at the outset let me tell that these are the information which we have got. So these are tentative questions, and based on the tentative questions which we have got, the tentative answer can be framed accordingly, right? So once we get the foolproof questions, then we'll again come with the foolproof answer. But as of now, whatever questions we came to know from the students, so we have framed that, and accordingly, based on the questions which we have received, the answer, what can be the possible answer, I'll be explaining that. So let's start, and And one of the questions which the student said, that there was a questions on population, so population size catered by urban PHC, right? Now, students, one thing I'll tell you here, before 2022, these questions were not asked much. But now, after 2022, these questions and such questions will be asked repeatedly. The reason behind that is the Government of India has come up with a new IPHS guideline 2022, right? So 2022 guideline has got certain amendments, certain changes they have done. So it is important for you to remember that. As far as the question is concerned, urban PHC, so we all know, I don't know what was the option, but urban PHC caters roughly around 50,000 population. So if the question had an option of 50,000, so 50,000 will be 50,000 population will be catered by one urban PHC. Now, why I am emphasizing here on IPHS standard 2022, because NHSRC has come with a new IPHS guideline 2022, and it is now, we have a terminology called Health and Wellness Center, and which is now also changed as Ayushman Arogya Mandir, right? So this Health and Wellness Center, PHC, in rural area it is, in a plain area it is 30,000. So one PHC will be of 30,000, and one hilly and in hilly and tribal areas it is 20,000. When we talk about urban PHC, it caters 50,000 population, which was the question. And also in urban area, we have a new concept of polyclinic, which caters a population of 2.5 lakh to 3 lakhs. So this was more or less same. Now, what are the changes made? The subcenter, we don't call now subcenter, it is now Health and Wellness Center, which is also called as Ayushman Arogya Mandir now, So this is catering 5,000 in rural area, in a hilly and tribal area it is 3,000. Now we have a concept of urban health and wellness center, which caters a population of 15,000 to 20,000 also. So you have to remember this also. There is a possibility it can be asked in future also. The community health center, the CHC, the rural CHC caters a population of 1,20,000 in plain area, and hilly and tribal areas 80,000. As far as urban CHC is concerned, it caters 2,50,000 in non-metropolitan areas and 5 lakh in and above in metropolitan areas. So these are the few changes this health and wellness center concept has come. So you have to be very mindful when such questions come. But the question was about urban PHC. Urban PHC caters a population of 50,000, right? So I just thought just to share with you. Now the second question was related to TB related web portal, which is the technology based surveillance system. And whenever we come across this, nowadays TB is very important because we have made a commitment, Government of India has made a commitment to eliminate TB by 2025. So the surveillance system is NEET-PG, right? K, NEET-PG. The answer was NEET-PG. Now I'll show, and NEET-PG is basically a pregnancy testing kit. DOTS is a strategy, right? Directly observed treatment short course chemotherapy is a strategy, and 99 dots is basically when you're taking a drug. The patient has I'll just show the picture also. What the patient does, take the pill, and on the back of the flip there is a number on which they have to give a missed call, which gets recorded. So that is 99 dots. So in this question, if this is the question, the answer is NEET-PG. Now, just to show you, this is the National TB Elimination Program NEET-PG portal, where any health facility can log in and can see the record of TB cases. Now, this is the NEET-PG part, which they have given in the option, which is for pregnancy testing, which is by Government of India. And this is that 99 dots where you start here and you get a number and you have to give make a free call or a phone number after taking the pill. That get registered that you're adhering to the treatment guidelines. So this is 99 dots. Now, another question was about ideal antenatal visits. Now, I don't know what was the full question and what were the options, but ideal antenatal visits you have to understand in 3 ways, right? The first is, what is ideal? What is minimum? And this minimum also by Government of India, and what WHO says, right? There are 3 things which you have to remember, because whenever ANC comes, you need to have these 3 you have to know. Now, ideal is, ideal, I don't know the options, but if the ideal is, the best way of remembering ideal ANC visit is for first 7 months, what we say, every month. So that becomes 7 visits. In the 8th month, we say fortnight. So that becomes 2 visits here, 7 to 9. And in the 9th month, weekly. So that becomes 4. So roughly around 13 visits visits has to be made ideally. So the option had 13 to 14, 12 to 14. You can go with 12 to 14 answer, right? Because it is ideal. Now, so this is the way ideal, 13 to 14 visits or 12 to 14 visits. So first 7 months, every month we have to do ANC visits. The 8th month we are doing twice a month, fortnightly, and 9th month we are doing once a week. So it becomes roughly around 13 to 14 visits. Now the minimum Government of India recommendation is 4 visits. Right? First, as early as possible. Second, you have to do 14 to 26 weeks. Third, you have to do in 28 to 34 weeks. And fourth, you have to do in 36 weeks. So 4 visits has to be done as per Government of India. Now, WHO in 2016 has come up with 8 visit plan. Right? So first contact up to 12 weeks, second contact into 20 weeks, third contact into 26 weeks, and fourth, 30, 34, 36, 38 and 48 weeks. So total contacts has to be 8 visits. So as what we have to remember, 12 to 14 is ideal, 4 is Government of India recommendation, and 8 is WHO recommendation. So based on that question becomes easy, we can answer it, right? Now there was another question about maternal mortality ratio and this is infant mortality. Now by 2030, now this is a catch. When we say 2030, the question is related to SDG, right? Sustainable Development Goal, because it has started in 2016 and it will end in 2030. Now we all know there are 17 goals. The third one happens to be health. and there are 9 plus 4 additional targets. So 9 targets, out of that, the first target is about MMR. So MMR, clearly it has been written that maternal mortality ratio has to be less than 70 per 1 lakh live birth. So if this was in the option, this will be correct. Now second, infant mortality rate is not in that SDG targets. Please remember. I'll just show you. So maternal mortality ratio less than 70 per 1 lakh live birth, and the second one is my neonatal mortality rate and under 5 mortality rate. So under 5 mortality, the target is 25 per 1000 live birth, and neonatal mortality, it is 12 per 1000 live birth. So even if we all know that maternal mortality ratio has to be less than 70 per 1 lakh live birth by 2030, that has been the target set by SDG. So if that had the option, please go with that. Infant mortality is not mentioned in SDG. There we have under 5 mortality 25 per 1000 live birth, and neonatal mortality 12 per 1000 live birth. Okay. There was also one of the questions somewhat related to this, instilling a particular point of views in people's mind. Now you're instilling a point in people's mind and restricting their independent thought. So I am trying to force someone to think the way I want, and I don't let them I don't let them to think in the way they want, comprehend in the way they want. So what that can be? That cannot be health education. That has to be health propaganda, right? That has to be health propaganda. So the difference when we read the difference between health education and health propaganda, the first difference is the question they have asked. Instilled in mind, no? So the knowledge and skills, whatever you're talking, it is instilled in mind. It's not letting you to think. It's not letting you to, reflect. It is telling you to, no, whatever I am saying, believe in that. So the answer has to be health propaganda. It cannot be health education. Okay? Okay. So I don't know, I came to know that there was a direct question about laterism. So if it was, so laterism is caused due to the consumption of, we all know that dal, kesari dal, and the toxin is BOA, beta-oxaline aminoalanine. But I have also heard that there was, now, so this is a table which helps us to remember the disease and the toxins, the dropsy, sanguinarine, ascites, pyrazidine alkaloid, aflatoxin, ergodone, clavin alkaloid. But I also came from one of the student that no, there was a question, some clinical based question, where certain food items were consumed and there was swelling, visual disturbance and heart failure. So what is the probable containment? So if the direct question was related to laterism, the answer is BOA and kesari dal. And if this was the question, the answer is epidemic dropsy. Now I'll show you the picture. So epidemic dropsy, we know all that mustard oil is contaminated with argemone oil, right? And the toxin is sanguinarine. And you can see these are the edema which is present, and the features are non-inflammatory edema. You can also, in the lower limbs, you can have cardiac failure and death. So if that was the question, the answer will be epidemic dropsy, and the toxin is sanguinarine, right? So probably whatever is the question, the answer will be accordingly. So there was also an image-based question which was related to this, and so we all know this is first generation IOD, which is lip is loop. It's an inert IOD. So this was a very easy question. I hope everyone got right. And so this is non-medicated IOD, inert IOD, lip is loop. So I'm not going to go in this in detail. This was the easiest one. Now there was again a very easy question, I suppose. Most common cancers among females in India. Now, in India, when it comes, we may have a double thought that is it cervical cancer, but nowadays in India also it is breast cancer, students. So don't get confused. The answer will be breast cancer for this. If that was in the option, breast cancer will be the answer. Now, 2022 data, if you see, in male, the maximum incidence is lung cancer. globally, and in India, if we talk about India, it is oral cancer. In female, if you see both in India and globally, the breast cancer leads. So in the question was females and it was in India, so breast cancer will be the answer. Okay. Now, the next question probably was, what percentage of data falls within one standard deviation of the mean in a normal distribution? Now, this is a question, so the question is mean plus minus 1 standard deviation, mean plus minus 2 standard deviation, mean plus minus 3 standard deviation. So the question says within one standard deviation plus and minus. So if it is this question, the answer will be 68%. If it is mean plus minus 2 standard deviation, the answer will be 95%. And if it is mean plus minus 3 standard deviation, it is 99%. Right? So I'll just show in the graph also. So this is the accurate. So this is plus minus 1 standard deviation, that is 68.26. Plus minus 2 standard deviation 95.45, and plus minus 3 it is 99.7. There has been a tricky question asked about mean plus 1 standard deviation. If they ask, they don't say plus minus, they are saying mean plus 1 standard deviation, then it will be only 34%, only half of 68. So you have to read such questions carefully. At times but if the question is asking separately. But in this question, if that was the question, the answer will be 68%. Okay. Now there was another question, probably wasting, something related to wasting. How does it measure? How you measure wasting, right? So wasting, there are 3 terminologies, students. First is underweight. Second is stunting. And third is wasting, right? So let's go with first stunting because that becomes easy. You're measuring height in comparison to age, right? So when you're measuring height, as the age is increasing, whether height is increasing in proportion or not, so that is basically measured by height and age, and that reflects whether stunting has happened or not. Minus 2 standard deviation, less than minus 2 standard deviation. So this indicates chronic malnutrition, right? Now let's come to wasting. Weight related to height. You're measuring weight and height, comparing weight and height. So this is acute malnutrition. So if related to wasting, it was weight and height, the answer will be weight and height. And if the question, and underweight is weight related to age. So this can be acute also, this can be chronic also, it can be both also. Just to show you, students, the growth indicators. I'm not going to the obese part. I'll just go to the underweight part. You see, height and age, when you compare that, we come to know about, that gives information about stunting, and it is chronic malnutrition. When you are talking about weight for age, that indicates whether it is underweight or severely underweight, acute, chronic, or it can be both. When you're comparing weight and height, it also indicates acute malnutrition. So I think probably the question was this. We can also compare BMI for age, and that also gives information about wasting and severely wasting. But here, weight, height, acute malnutrition, wasting, weight, age, underweight, acute and or chronic or both. Height and age, it is stunting, chronic malnutrition. Okay. Now, one of the question I heard, whether it came or not, I cannot say, but somebody said this was the question. Number of live birth per 1,000 women in reproductive age group is referred to as NRR, GRR, GFR, TFR. If it came, student, so you have to understand it is general fertility rate. Right? In 1,000 women, how many live births has happened? Because you see total fertility rate, I'll tell you, total fertility rate, gross reproduction rate, net reproduction rate. What is the relationship between all these three? Simple. TFR says, in simple terms, one woman, how many children in her entire lifespan, based on current fertility pattern, assuming no mortality. Gross reproduction rate is same as TFR. The only difference is one woman, how many female child. right? Suppose TFR, one woman has got 4 child, and out of that 4, 2 are female child, so GRR will be 2. And what is net reproduction rate? It is one woman, how many female child alive, who is alive, who is not dead. Suppose it is one died, so my net reproduction rate is 1. So, but the question, if it is framed in this way, the answer is general fertility rate. Okay, and the difference between TFR, GRR and NRR I have already explained here. Now there was another question related to exclusive breastfeeding. This was the easiest one. We all know exclusive breastfeeding is till 6 months. Beyond 6 months also you can do feeding till 2 years, but exclusive breastfeeding is till 6 months. I hope everyone got right this question. Okay. Now there was another question which was related to scrub typhus, vector responsible for Tsutsugamushi. We all know the answer was mites, trombiculid mites. So the scrub typhus, if this was the question, the agent is Tsutsugamushi and the vector is mite. So this was the answer, easy one, not a tough one. There was also a question on definition of blindness. So as now the WHO has given this definition, that visual acuity of less than 3/60 or corresponding field loss in the better eye with best possible correction. So this was the easiest one. So the answer is 3/60, right? Okay. There was also questions on fluoride, how it is associated with crippling fluorosis. Now this is important. Fluorosis we all know, crippling fluorosis. Now crippling fluorosis, just for you, we all know fluorine is a double-edged sword. If you take less, it can lead to caries. If you take excess, it can lead to dental and skeletal fluorosis. The normal is 0.5 to 0.8 milligram per liter. But if the level is more than 1.5 part per million, that can lead to dental fluorosis. If the level is between 3 to 6, it is skeletal fluorosis. If the level is more than 10, then it is crippling fluorosis. If the option was 10, greater than 10, then the option will be crippling. The option will be greater than 10 part per million, crippling fluorosis, right? I think the question was related to this. Okay. Now there was another question on occupational health, pneumoconiosis caused by exposure to cotton dust. So this was the easiest one. We all know cotton dust leads to bisonosis. So if this was in the option, so we can go with the answer bisonosis, because bagayosis is sugar cane, silicosis is silica, anthracosis is coal dust, asbestos is asbestos dust. So bisonosis is cotton fiber. So the answer was easy, bisonosis. Now there was also a question on Anemia Mukt Bharat, and I have seen of late lots of questions being asked on Anemia Mukt Bharat. Now why this question becomes important, and when I had a discussion with the students, they said that it was related to IFA consumption in pregnancy and lactation. Now let me clarify one thing here, that 100 days concept, first you read in the book, also somewhere it is written IFA has to be given for 100 days. That has gone now. Anemia Mukt Bharat says that you have, I'm talking about the pregnancy and lactation, you have to take 180 days. 180 days during pregnancy and 180 days during lactation, right? And 60 milligram of elemental iron and 500 microgram of folic acid. So this is the combination which has to be used. So in pregnancy 180 days starting from second trimester, and in lactation 180 days till 6 months. And also I'll also show you, so this is a table which you can keep on revising if it is, whenever it is related to us to Anemia Mukt Bharat. So it says iron and folic acid from 4th month, which is second trimester, and continued for minimum 180 days during pregnancy and 180 days postpartum. So 180 days during pregnancy, 180 days postpartum. So it becomes 360 total, and that has to be 60 milligram elemental iron and 500 microgram of folic acid. So, and I have seen in a book also somewhere it is written 20 milligram of elemental, 100 milligram of elemental iron, 500 microgram of folic acid. That has to be given for 100 days. Now that 100 days concept is not there. Under Anemia Mukh Bharat, they have clearly mentioned that in pregnancy you have to give 180 days during pregnancy and 180 days in lactation also. So total pregnant lactating mother is receiving, 360 tablets. Okay. Now there was also a question on epidemiology. And if you read the question, I don't know what were the answer, but the answer will be a study done in 3 states to see mean blood pressure in each community, right? Health worker assigned and visited each houses of 3 communities. So 3 states, the study has been done to measure the mean blood pressure. The health worker were assigned and they visited each houses of the 3 communities, and then they made a comparison. So the study, you went there, you collected the data, and you analyzed and you compared and gave the result. This is a classic example of cross-sectional study. Neither you are going backward, neither you are going forward. You went to the villages, you collected community, you collected the data, analyzed it, compared it, and you gave the result. Classic example of cross-sectional study, snapshot study, right? Okay, there was also a calculation based. In a given population, total birth was 4050. So total birth, mark this 4050. 50 was stillbirth. Okay, so if I can ask, before I go further, so 4050 is total birth, and if I subtract 50, which is stillbirth, so I get 4000. So can I say this 4000 is my live birth? When this is birth, I have subtracted stillbirth, so I get my live birth. Because what I see in the next part of the question, they are telling you to calculate neonatal mortality rate. Okay, we all know neonates, it's from birth till 28 days. Okay, the next part of the question is 50 neonates die within 7 days. Early neonatal death has been given 50. Whereas number of death within 8 to 28 days, it is 150. So late neonatal has been also given, which is 150, late neonatal mortality. Now they are telling you to calculate neonatal mortality. So neonatal mortality becomes early neonatal plus late neonatal, which is 150, and out of total live birth. So the catch was, did you subtract 50 from 4050? If yes, then the denominator becomes 4000, and then you express this in 1000. So you get the value as 200 divided by 4000 into 1000. So the answer will be 50. I guess B is the answer. Okay, simple one. The only catch was, did you subtract 50 from 4050 or not? If yes, then you will land yourself correctly. Okay, there was another direct question, folic deficiency in pregnancy causes. We all know neural tube defects, so I'll not waste time. This was the easy one. Everyone would have answered correctly. There was also a question I came to know, in a community for malaria, out of those vaccinated, 6 had the disease, and out of those non-vaccinated, 12 had the disease. Calculate the relative risk. Now this was some tricky one. Many students may have thought, what, how can we, there is no exposure and incidence in exposed group, non-exposed group. But those who were vaccinated, try to understand. Those who were vaccinated, out of that, 6 developed disease. Those who were non-vaccinated, and that is the reason I say relative risk on all these epidemiological formulas don't require formula, it requires an understanding. Non-vaccinated had 12 disease. Now imagine those who were vaccinated, but then also they developed 6 disease, and those who were non-vaccinated, they developed 12 disease. So you take the ratio. So it will be 1/2, 0.5. So what is the probability? The probability, it says that those who are vaccinated, their 50% chances is less of having the disease in comparison to non-vaccinated, which is 50% here, 1/2.5. And so what is the vaccine efficacy then? Vaccine efficacy, 1 minus relative risk, or 1 minus 0.5, which is 0.5, 50%, right? So if the answer was 0.5, in the options, the answer will be 0.5, right? So this is the way relative risk. So in comparison to vaccination, and non-vaccination, where the disease was more. Obviously, those who were non-vaccinated, 12 people suffered, 12 people had disease. And those who were vaccinated, they had only 6 people were having disease. So the ratio is 0.5. Okay. I heard there was a question on growth rate. Now, please understand, such questions don't need you don't have to learn the formula of growth rate. Please remember, and this is the way I explain, current growth crude birth rate of India. If you ask me, it is 19.5 per 1000 mid-year population. Current crude death rate of India is 6 per 1000 mid-year population student. Now let me put here. So in 1000 population, 19.5 birth is happening. The simple explanation. And in the same 1000 population, mid-year population, 6 people are dying, death. So in 1000 population, what is the growth? It is 13.5. In 1000, 13.5. So what is the percentage, if I ask you? So 13.5 into 1000 into 100. So it is 1.35. So this is my growth rate. So simple. I don't know what was the question, but it was related to growth rate. This is the way you need to understand. For every 1000 mid-year population, 19.5 birth. This is the current data. This is not wrong. This is absolutely correct. And crude death is 6. Now, so what is the growth? For every 1000, 13.5. We are increasing the population by 13.5. So in 1000, 13.5, how many in 100? That is percentage. So the population, the growth rate is 1.35%. Okay. There was also a question on dependency. So there was a question on that there was a person of 68 age, so 65 and above. So this is my dependent. B is 59, not dependent. Son 30, not dependent. 30. 27, not dependent. And a grandson of 5, dependent. So we all know 0 to 14 years. And from here to 64 and here. So this is a working group. This is my dependent. This is my dependent, right? So I see 2 people dependent on 3. So 2 by 3 into 100. So roughly around 66.6%. If that was there in the option, you can go with the answer 66.6%. Okay. Now, I heard there was a question of penicillin injection for treatment of rheumatic heart disease is which level of prevention. Now, somebody said that it is a primary prevention, we are giving against RHD. No, you have to read this. The patient has been already diagnosed as rheumatic heart disease. The disease has already occurred, so there is no question of primary prevention. You are trying to treat the patient. And if you're trying to treat the patient, it becomes secondary prevention. It cannot be primary, because primary prevention is action taken prior to onset of disease. The disease has already occurred, no? You are giving the treatment. So what is the mode of intervention in secondary prevention? Early diagnosis and treatment. You are giving treatment, so that will be secondary prevention. Okay. There was also a question of per capita space for each working according to Factory Act. For each worker, so it is 500, we all know 500 cubic feet. A minimum space of 500 cubic feet space per worker is required. So there are 5 sentences I have made. These are asked, 5 one-liner, 1 safety officer per 1000 worker, 1 welfare officer for 500 workers, 1 canteen for 250 workers, and 1 creche for 30 women workers. Okay. There was also a question on contraceptive failure. MTP is allowed for how many weeks? The simplest one, 20 weeks, we all know. And the amendment, the act, we know pregnancy can be terminated up to 20 weeks due to failure of contraceptive method or any device by a married woman in case of failure of contraceptive method device. So 20 weeks may be the answer. Now the new bill also says unmarried women can also terminate a pregnancy for the reason. And just for your easy reference, I'm just comparing 1971 with 2022, and you can see this has been, the changes, up to 12 weeks I have to terminate, one doctor 12 to 20 weeks, 2 doctors, here only 1 doctor is required. 20 to 24 weeks not allowed. Now it is allowed here. 2 doctors for same category of pregnant can do more than 24 weeks. The medical board has to be formed, right? But the question was related to contraceptive failure, so 20 weeks will be the answer. So these were the questions which I came across, and I tried to answer based on whatever information I had. There is a possibility the question may have some other tricky thing which we may not have got it. So the answer can change accordingly. Once we get a foolproof questions, definitely we'll come back. Medway will come back with a definite answer and an explanation. I hope, and I am sure majority of the answers you would have done correctly, and wish you a very best of luck. And once we get a foolproof questions, definitely we'll come back with the appropriate answer and explanation. Thank you very much for watching.